Hey everybody, welcome back to our YouTube channel. My name's Agan. I'm an ear, nose, and throat doctor, and I work with
Alix Agan,
my sister, and we have an ear, nose, and throat medical practice in Dallas, Texas that specializes in direct care, meaning we are intentionally out of network with insurance companies, which allows us to provide patients with a pretty exceptional patient experience when they come to the office. Today, we are going to have a little conversation about allergies. Would you say that's a pretty common thing that patients see us for?
It's very common, yes. Mm-hmm.
So, Alix's background is not in medicine.
Right. I had a background mostly in hospitality. I do have a bachelor's degree in business, but I spent most of my early career in hospitality. So this is kind of a new spot for me. There's a lot to learn, and every day I'm learning more and more. So allergies, for example, vast, lots of things, ragweed, what else? Just so many things. So
what questions do you have about allergies? Do you yourself suffer with allergies?
Not really, but I think I'm one of the few.
Well, I feel like our family has a lot of allergy sufferers.
I know.
You.
Not me.
Lucky.
I was the lucky one.
Well, I have been an allergy sufferer since I was really young. So I was doing the allergic salute, which is when you see kids do this little thing to wipe their nose. I was doing that at a very young age, and wiping, having the stiff sleeve of the sweater from doing this. So I have been suffering for a long time.
And our younger brother too.
Yeah,
he's definitely got
our little brother, our dad.
Mm-hmm.
So maybe you and mom you've got mom's genes from an allergy standpoint.
I'll take it.
What is allergy? In the ENT world, when we talk about allergy, we're mostly talking about the nasal symptoms of allergy, meaning what we call allergic rhinitis. So that's typically sneezing, runny nose, stuffy nose. Sometimes it can be itchy, watery eyes. Sometimes patients can also have asthma, which is it's like allergy of the lower airway, so in the lungs. And it can fluctuate with the seasons. So some patients are only allergic to tree pollen, which means you're going to be more symptomatic in the spring. And some patients are allergic to everything, like, trees, grasses, weeds, so they're symptomatic just year round, because once they move out of one season, they move into the next season.
So does that mean that they always need to be on some sort of medication if they're,
Yep. Good question. So typically, it just depends is the short answer. So some patients will take their allergy medicines during their, slightly before and during their season. And then patients who suffer all year long, yes, sometimes are essentially on allergy medications 24/7, 365.
So what about, how do they know when they're sick versus when they're having an allergic reaction?
That's a good question, because sometimes it can be hard to tell. Sometimes a really bad allergy exacerbation, which is just kind of a fancy way of saying like an allergy attack, when your allergies really kind of ramp up in intensity. Sometimes that can feel a lot like you're getting sick. And even personally, I've had episodes where maybe at the beginning of an illness, I thought, my allergies are just really bad. And then after a day or two, I started having maybe fever or body aches or chills. And then I said, oh, wait, no, this is actually, I have a cold. And so the symptoms can overlap. Typically, the big differentiators are symptoms like more systemic types of symptoms like body aches, chills, feeling run down, having a fever, maybe sore throat. Although sometimes sore throat can cross over and patients can have so much drainage that they get some sore throat or lose their voice, but I would say that's not quite as common.
Another question that we get is blood testing versus skin testing.
Yeah. So,
and do you recommend one over the other? And age groups, is one better than the other?
Yeah.
What do we?
So the whole point of allergy testing is to know what you're allergic to, and so I think the question is like when to allergy test. Like does everybody need to be allergy tested? So sometimes we talk about your symptoms. We say, okay, this sounds like allergies. We start maybe a nasal spray, and things are better, and then that's kind of the end. You take your nasal spray when you need to, and that's fine, because maybe sometimes the picture is just very clear cut. Like, as soon as the trees start to bloom, I get sneezy. That's the only time of year. We can kind of say, it sounds like you're allergic to tree pollen. Let's use your nose spray during the spring. Okay. Reasons to allergy tests would be to know for sure exactly what you're allergic to, which then gives you the information you need to be able to plan, avoid, and potentially treat with immunotherapy. So let's break those down. So from a planning standpoint, if you know that you are allergic to tree pollen, for example, then you're going to know that as spring is coming and as the trees start to bloom, that you're going to get a little bit more sneezy, a little bit more stuffy, and you might want to start your allergy medicines a little bit before then so that we can kind of get you through that season. So, or if you're allergic to an animal, like a dog or a cat, and if you're visiting grandma and they have a cat, you will know, oh, maybe I need to take an antihistamine before I go over there because I'm allergic. Second is avoidance. So if you have a dog and you are allergic to dogs, first thing, nobody gets rid of their pets, right?
No, that's not
but what we can do is keep the dogs out of the bedroom and off the bedding. So, if let's say you sleep 8 hours at night, you're spending a third of your life in your bedroom. So if we can keep the animals out, then at least during that time, you're not exposed to that allergen, right? Same thing if we know you're allergic to dust, then we might have you clean your bedding in hot water frequently. We might have you, if you're going to remodel your house, we would recommend avoiding carpets. So there's things we can do to try to avoid your exposure to whatever you're allergic to. So that's why it's nice to know what you're allergic to. You can plan and you can avoid. And then that third step is what we call allergy immunotherapy, which just means we're giving you a small dose of what you're allergic to over time so that you can develop tolerance to it. So that when your body encounters it, eventually it will just be like, oh, this is just tree pollen. We don't need to get all inflamed.
How long does that take?
It's a good question. So that process can take years, and there's different ways to do it. So allergy shots, most people are familiar with allergy shots. You go into the office and you get a shot usually about once a week. Allergy drops, what we call sublingual immunotherapy, or you might see it written as SLIT, S-L-I-T. This is drops under the tongue that you can do at home, so you don't have to come into a doctor's office to make that appointment, so it's much more convenient. And then tablets are a newer piece of this, where the tablets are prescribed just like you would any other prescription. So you get it from your pharmacy, you put the tablet under your tongue, it dissolves. And we have tablets for dust, grass, and ragweed. So depending on what you're allergic to, tablets might be a good option. Tablets may be covered by your insurance. Sublingual drops are usually not covered by insurance because they are compounded specifically for you. Typically, that's going to run about between $150 to $200 for a 3-month supply. So still, I think, relatively affordable and way more convenient than going into the office. And then shots typically are covered by insurance, but you may have a copay each time you go. So depending on what your copay is, the price could be the same as doing the sublingual drops.
Got it.
But you're going to do that for 3 to 5 years. Doesn't mean that you don't see benefit before then. Usually by 6 months, patients will see some benefit and an improvement in their tolerance to whatever airborne allergen is causing their symptoms. But they may still need to also take their allergy medicines during that time. And then as far as how to test, you mentioned how do we test. So we can test with a blood test or skin prick testing. There's also something called intradermal. But blood test and skin prick testing are the two most common ways. With a blood test, you're just going to do a blood draw, and they're going to check for something called circulating IgE. So it's a particular antibody against around 30 different antigens, and it's location specific. So if you live here in Texas, you're going to be tested for region 10 allergens, because there's no point in testing you for a tree that is native to Wisconsin that we don't have, for example, right? And so that the advantage of that test is that it's quick and easy. So you go in, you get your blood drawn, it's done. You don't have to stop taking your allergy medicines. So when we do skin testing, you do have to stop your antihistamines for usually about a week. And so with blood testing, you don't have to. The skin prick testing, your skin is actually going to be just gently pricked with all the different antigens. So depending on how many we're testing for, you could have, 30 different prick sites. And then we measure the wheel. So your skin is going to react, and you'll have like a little red wheel that will measure. If it gets really big, then you're really allergic. If it doesn't get big, then you're not allergic. So that one is more time consuming. That one you do have to be off your antihistamines. It is a little more sensitive.
So I have a question.
Okay.
So in my brain, I'm just thinking, I keep thinking about that story Mom tells about Ty getting allergic testing, and she said it was just horrific,
horrible.
The worst experience ever. Is it really, should moms be concerned when they take their kids to get tested? Is it something that is really painful, or did he just have a bad experience?
That's a good question. Do you remember how old he was?
He was maybe 3 or 4. I don't know. He was little.
That age group is probably harder, and it gets itchy. And they usually, with smaller kids, they do it on their back.
Yeah, I think it was on his
and
back.
so you're putting all these different allergens on the skin, and it's going to react and become itchy. It's usually not painful because it's not needle sticks. It's like literally imagine just putting like a little. It almost looks like a comb, or a little brush with like little bristles coming out that like prick the skin.
Got it.
It doesn't draw blood.
Okay.
Just enough to kind of make an indentation. But with smaller kids who you can't really talk through it and explain what's going on and explain why they have to be still and explain, I could see that being challenging.
Yeah.
Yeah.
Fair enough.
So yeah, and then with that information, then we kind of review what you're allergic to and talk about planning, avoiding, and potentially immunotherapy.
All right, there you have it.
That's a wrap.
That's a wrap.